Ectopic pregnancies. In normal pregnancies, a fertilized egg is released from the ovary, sent through the fallopian tubes, and into the uterus. Once in the uterus, the egg attaches to the lining and remains there and grows for the next 9 to 10 months.
However, in many pregnancies, complications can occur. A common type of complication is what's called an ectopic pregnancy. An ectopic pregnancy is when a fertilized egg implants itself into either the fallopian tube or the abdominal cavity.
This happens in every 1 of 50 pregnancies and can sometimes be fatal. An ectopic pregnancy can result from an abnormally shaped fallopian tube. The risk of an ectopic pregnancy can increase even after reconstructive surgery has been done on the fallopian tube.
Other risk factors may include other ectopic pregnancies, fertility issues, the use of birth control or devices. Also, STDs like chlamydia and gonorrhea can cause inflammation of the fallopian tube, which can cause the egg to be stuck in the fallopian tube on the way to the uterus.
Ectopic pregnancies are usually not detected until after the first month. This is because the first signs and symptoms of an ectopic pregnancy are the same as those of a normal pregnancy. Later symptoms that occur are abdominal and pelvic pain and light vaginal bleeding. In some cases, the fallopian tubes rupture and call for emergency surgery.
And this is what a normal fetus would look like after 1 month.
And this is to scale what it looks like, and you can see it right in there. It's really tiny. It's not even bigger than the top of my finger.
If your doctor believes that your pregnancy is ectopic, he will perform an ultrasound. Sometimes, though, it is too early to know through an ultrasound, so the only sure way to know if you have an ectopic pregnancy is through blood test.
Since it is not possible for a fertilized egg to develop outside of the uterus, ectopic tissue must be removed. This can be accomplished through one of two treatments. A drug called methotrexate can be administered to the patient to prevent cell growth and dissolve any existing ectopic tissue.
A surgery procedure called laparoscopy may be needed to remove additional ectopic tissue and to repair the fallopian tube. Removal of the fallopian tube may also be needed if the damage is very significant.
And this is a diagram of a laparoscopy being conducted, and you can see that this is the laparoscope, and this is the fallopian tube where the needle is going in to take out the fallopian tube and the existing ectopic tissue.